So Lauren, thank you so much for coming in to speak with me today. And I understand you just had a baby.
I did just have a baby. He is 8 weeks old today.
Yeah, baby Landon.
Yep.
And is he sleeping for you?
For the most part.
Yeah.
Sometimes he's up every 2-3 hours, but he gets his little 4 or 5 hour spans.
You know, I'm a pediatrician, and I used to tell parents, parents can get through just about anything if they can get some sleep. So we were always hopeful that babies would go home and give their parents a break and take good periods of sleep early on. So I'm excited for you for that. So tell me a little bit about what you've been doing for us at GBMC.
So I've been here since the August of 2018, and
great.
I started in employee health. When I first went up there, I came in as a LPN, and I was kind of like the front desk and overflow person. So anyone who came in for updated immunizations, return to works, I did that along with answering all the phones and kind of maintaining the front. As I've been there, my role has grown and I've transferred into many different roles in the department. I did compliance for about a year, and then the last year I've been doing workers' comp and FMLA while going to school full-time to get my RN.
Wow, so that's a lot, and you've been doing this in a time of a lot of employee turnover too, in large part because of the pandemic, so you must have had a lot to do every day in employee health.
Yeah, and then we had, with the pandemic, the COVID protocols that all changed, and that was a huge impact on the department.
Yeah, and you were going to school full-time, or going to school to get your degree, huh?
Yeah.
And tell us a little bit about that. Where were you studying?
So I went to the community college of Baltimore County. I started at the Dundalk campus, and that's where I did my LPN, and then I transferred to the Essex campus to finish my RN.
Great. And what interested you in going on?
To finish my RN?
Yeah.
I always wanted to be an RN, so I got waitlisted when I had first applied. So when they offered me to go to the LPN program, I was like, yeah, why not? I'll try it out. And I actually worked in long-term care for 12 years before I came to the hospital. So when I got my LPN, I stayed on PRN with them when I came here, but I always wanted to work in the hospital. I didn't want to stay in a facility. So I decided when I saw the opening for employee health, I was like, well, I'll just go, it's a way in the door. I never thought I would love it in there, but I ended up really learning a lot and expanding my administrative roles as well as like clinical roles, because there's a lot that goes into employee health that no one knows about. Occupational health is a completely different specialty that you're not taught. So I really enjoyed my time in that department.
That's fabulous. And now on to the emergency department?
The emergency department. I always wanted to be an ER nurse, so when I got my RN, I knew that's what I was going to do. Where I didn't know, I hoped to stay here, and I, landed a position there, so.
Fabulous. And what is it about emergency nursing that attracts you?
I think it's the speed. I want to keep going. I like to be moving. I don't like to be stationary during a, whole shift. So that was very different when I started in employee health too, because it was very administrative and a little bit slower than what I was used to. I wanted to go back into the speed of things. And with having a baby, doing 12-hour shifts, for me, I think is going to be easier than being 5 days a week in a department.
Yeah, what a great next step in your career. My hat goes off to all of our nurses. They are the backbone of the healthcare delivery system, and without excellent nurses, we can't do anything. We can't move towards our vision, and I'm really delighted for you. What do your friends think? What's your family think about all this?
So a lot of people at first were like, you're leaving an occupational health position to go into the height of the pandemic. But at the same time, like, my family's like, well, that's what you've always wanted to do, so you have to do it. And, my friends are like, yeah, that's where you belong. You need to go down there, so.
Isn't that fabulous? Just think of all of the people who you will be able to help over the next years. And I also think it's fabulous that this shift-based work allows you to be a great nurse and a great mother at the same time. And I really appreciate your thinking about that, about how to how to do both and do both of them well, and to not have the complexity of trying to figure out the child care 5 days a week. I think that's a great idea. Do you have any immediate goals for when you start in the emergency department?
So starting down there, it's just going to be getting acclimated, I think, to the unit. You know, I haven't been in there and I wasn't placing lines and doing EKGs every day, so learning those things are going to be exciting and challenging.
Yeah.
But I really want to further my career, and I think having the experience of the ED or like an ICU really helps you kind of go into higher roles. I don't know if I want to do education or if I want to continue on into, you know, like nurse manager or another role like that, but we'll see where it takes me.
Fabulous. Would you recommend your career path to others?
Yeah. I think all nurses should start as, I've always said this, but should start as like a tech, an LPN, and work their way up, because I think that you learn the roles of the unit and the department, and you have a better respect for people coming in. It's not like, oh, you're just a tech, go do this, or you're just this. Everyone is needed in those units, and I think that sometimes people forget that.
Yeah, what a great point. You know, we wear it on our sleeve that we believe in team-based care, and that the team won't go anywhere unless every team member is valued and the leader of the team looks out for them and listens to them and appreciates their input. So I think you have it framed beautifully. Thank you. Is there anything else you'd like to tell me about this wonderful next step in your career?
I mean, I'm just looking forward to moving on and seeing where it takes me.
Great, fabulous. Well, thank you so much, Lauren, for spending a few minutes with me. We are very grateful for everything you've done so far for GBMC and its patients, and we really look forward to the next step in your career. Thank you very much.
You're welcome. Thank you for having me.